Hello, everybody. My name is Dr. Vince Gutierrez. I am a physical therapist. You can find me at movementthinker.org. I practice out of the Joliet, Illinois area. If you ever need anything or you have any questions, feel free to hit me up on movementthinker.org or find me on Facebook at Dr. Vince Gutierrez. I highlight that because I just finished saying that the doctorate degree isn't what defines the profession. The doctorate isn't what you should be looking for. You should be looking for somebody who's good. I'd like to think I'm good. We just finished going over the subjective portion, which literally means the history-taking portion of the patient interaction. And now we move on to the actual movement and taking some measurements portion, right? So the first thing that we're going to do is you've been sitting there now for 20 minutes. I want to ask you, what are your symptoms doing? You may or may not have back pain. You may or may not have leg symptoms, numbness, tingling, pins and needles, pain. May or may not be radiating down your leg. But I do need to know where it's at and what it's doing and how you're sitting. And I can hear it now. Therapists are ready to jump down my throat. Vince, there's no such thing as proper posture. And I agree. There's no such thing as best posture. And as a patient, you should know that. If your therapist is trying to drive in this upright posture, chin back, chest high, Marine salute, and it's not changing your symptoms, then why the heck are you doing it? But there's a big but here. Becky, look at that. Never mind. There is a big but here. And if we change your posture and it changes your symptoms, can we at least agree that it's playing a role? We don't know what type of role, but can we at least agree that the way you stand or sit, the static position that you're in, the non-moving position that you're in, may be playing a role? If I move you out of that position and it either increases or decreases your pain, we have to at least say that it plays a role and we can't completely neglect it altogether. And that's what we're looking for. When I move you out of the position you're in, does it change your symptoms? And if yes, for the better, did you know that before you came in here? If you didn't, awesome, we both discovered something new about you. If you knew that, then I hope you told me that in the history portion, because then I'm going through and I'm confirming everything, that what you told me was actually right and not just what you believe to be happening. We look at your spine, and does your spine have a certain shape to it? The shape doesn't really matter, right? But when we change that shape, meaning you could have a big butt, right? A big arch right there. You could have a flat butt and a flat arch right there. Does that shape matter? And if we change that shape, does it change your symptoms? If it doesn't change your symptoms, I can't say the shape matters, right? It doesn't matter if you have a big arch or a little arch or a flat arch or a rounded arch. None of it really matters if we can't say that it's having an effect on your symptoms. And so that's what we're looking at. The next thing that we look at is, are you crooked, right? There are cases where patients come in and they are literally, their butt's on one end, but their shoulders are way over here. And these patients, they're typically in a ton of pain, right? I mean, I make jest about it because they're crooked, right? And but these patients are typically in a lot of pain when they come into the clinic. And our primary goal is to reduce the pain and try to fix that shift as fast as we can. And sometimes we even do that before we take a lot of the measurements because they're just in such excruciating pain. I'll give you a quick story though, right? Just because a patient is crooked doesn't mean that it's causing any symptoms. And that's something that I missed when I was a new grad. I didn't understand it. You were crooked, you must be straight, I must fix you. Ha! King, right? Not so much. I got humbled many times by patients, right? And I think that's something that we really have to learn from because we get to learn from the patient, you, every time that you come into our clinic. And so this patient was crooked. And, he was in pain. He had pain going down. Everything matched the picture that's painted in the book, right? This guy was perfect. He was crooked and he had symptoms that matched that crookedness. And so I went to fix the crookedness and over and over and over and over. And we went to fix the crookedness to no end. And I think I had this guy fixing crookedness for like 20 to 30 minutes and nothing was being fixed and his symptoms weren't changing at all. His symptoms weren't getting any better or worse. And I'm like, what the hell's going on? This isn't how it's in the book. This is not how it's written. And so I bring this person's wife back and I said, hey, what do you notice about him? I had him walk back and forth now at this point. So what do you notice? And she said, I don't know. What am I supposed to be looking for? I said, he's crooked. Do you not see it, lady? He's crooked. I didn't say it like that. I said, well, he's crooked. And she tilted her head, one of those dog things, and squinted her eyes, and her ears flopped a little bit. And then she said, you know what? He is crooked. I've never noticed. It's like, how long's he been crooked for? She goes, I don't know. He might have always been crooked. I was like, okay. And so in my eagerness to be king, to fix all, I completely screwed up. And I became humbled that day. Good thing that was early in my career and not 12 years later, right? Because it humbled me really quick. Anyway, this person responded very quickly to just changing his posture a little bit and doing one exercise, and his symptoms all turned off when he walked out of the clinic. I was so hell-bent that his crookedness had to be fixed that I completely missed all of the other principles that I was taught growing up through this profession. But yeah, sometimes you need to smack yourself in the face and say it's not relevant, right? And that's what I had to do that day. And so when I fixed his posture, his symptoms went away, even though he was still crooked when he walked out of the clinic. That's the biggest take-home message from this portion. Does your posture play a role in your symptoms? Not everybody needs to stand taller. Some people need to slouch in order to reduce their symptoms. It's okay. Your therapist should be working with you in order to discover, is there a better position for you or a worse position for you, and how can we best help you? Everybody, thanks for watching.